Vaccination campaign in the Gaza Strip was completed yesterday with an overall 556,774 children under the age of being vaccinated with a second dose of polio vaccine and over 400,000 children between 2 to 10 years old receiving vitamin A following the free phases conducted in the last week. Sasum Cham has the details.
The polio campaign being conducted by the Palestinian Ministry of Health in collaboration with the World Health Organization, the UNICEF, the United Nations Relief and Work Agency for Palestinian Refugees, and other partners, was part of an emergency effort to stop a polio outbreak in Gaza, which was detected on 16 July 2024, and to prevent further spread of polio virus. Administrative data confirm around 94% of the target population of 591,714 children under the age of 10 received a second dose across Gaza Strip, which is a remarkable achievement given the extremely difficult circumstances the campaign was executed under. The campaign achieved 103% and 91% coverage in central and southern Gaza respectively. However, in northern Gaza, where the campaign was comprised due to lack of access, approximately 88% coverage was achieved according to the preliminary data. This official says also increases the risk of further spread of polio virus in Gaza Strip and neighboring countries. The end of this second round concludes the polio vaccination campaign launched in September 2024. This round also took place in 3 phases across central, south, and northern Gaza under specific humanitarian pauses. While the first 2 phases proceeds as planned, the third phase in northern Gaza had to be temporarily postponed on 23rd October because of intense bombardments, mass displacement, lack of assured humanitarian pauses, and access. After careful assessments of the situation by technical community, comprising the Palestinian Ministry of Health, the World Health Organization, the UNICEF, and the United Nations Relief and Work Agency for Palestinian Refugees. The campaign resumed on November 2nd, but the area under the assured humanitarian pauses, comprising the campaign, was substantially reduced compared to the first round, as the access was limited to Gaza City. Due to surging hostilities, more than 150,000 people were forced to evacuate from Gaza to Gaza City, which helped in accessing more children than anticipated. According to the authorities, at least 2 doses and a minimum of 90% coverage are needed in each community to stop circulation of the polio strain affecting Gaza. Efforts will now continue to boost immunity levels through routine immunization service offered at functional health facilities and to strengthen disease surveillance to rapidly detect any further poliovirus transmission, either in affected children or environmental samples. The evolving epidemiology will determine if further outbreak response may be necessary to fully implement surveillance and routine immunization services, not just for polio, but for all vaccine-preventable diseases. WHO and UNICEF continue to call for a ceasefire. Further, apart from the attack on the primary healthcare center, the campaign underscores what can be achieved with humanitarian pauses. These actions must be systematically applied beyond the polio emergency response effort to other health and humanitarian interventions and respond to dire needs. Reporting for African News, I'm Sasum Cham.